Good afternoon, everybody. Welcome back, or welcome to this session of PMAC on social inclusion. It's about 2 o'clock. We are just a couple minutes late already. And I do realize it's just after lunch, which means it's kind of a very dangerous hour. You know, Secretary Dinky just told me that in the Philippines they call this hora de peligro, which means real dangerous hour. So we hope that collectively we will be able not to put you asleep. Now, whether we'll be able to wake up those of you who are already asleep, I don't know, but we will try our very best. So very welcome to this session. It's really an honor for me to be able to be here. I'll be your chair, and we have 5 distinguished panelists. I'll introduce them in a minute when we'll turn to them, each one of them. But let me say at the outset a couple of things why I think this is really important. I believe that we live in a world today which is a world full of opportunities for inclusion on health. There are a lot of people who do not have access to health care at all or to good health care. And this is what brings us together here. It's an opportunity to do better for all those people. We also live in a world of danger and risks for this goal, for this agenda. We know that there are large countries that have made progress a long time ago, some more recently, toward universal access for healthcare, and some of that is now at risk of being rolled back. We know that there are countries where there are groups that are left out, minority groups. They are stigmatized, sometimes criminalized, be they drug users, be they LGBT, be they ethnic minorities, whatever, and they do not have access. They are punished, attacked, sometimes clubbed to death, and they do not have access to adequate healthcare services. We know that's happening in countries here in the region. We know it's happening around the world. And we know there is around the world a growing number of migrants, refugees, really people in desperate poverty who have nothing at all. Some of them live on the streets, some of them live in camps, some of them live wherever they can find something. There is no good mechanism for providing health care for them. It's a medical challenge, it's a logistics challenge, it's a humanitarian challenge. That's why I think this is important. And we have a group here, a group of panelists. They all, in their very different ways, have devoted their lives to this agenda, to this goal of improving health services for everybody. This agenda of universal health care, access, good health care. And they bring different perspectives to this agenda from their various past careers, lives, and I don't really want to say much more than that because each of them will speak for themselves. Just in terms of giving you a heads up on the order of events, I will ask each of them, turn one by one, to make an introductory statement, share a little bit of their perspectives for about 5 minutes. And then after that, I will turn to the floor. I will open it up. We'll take up to 3 questions. I understand there are microphones and we can collect them. If you like to direct your question to a particular panelist or a couple of particular panelists, please say so, and we'll turn the question to them. If you would like to ask a general question, that's okay too, and we will do our best to answer it as among the panelists.